Alright, we'll go ahead and we'll get rolling, everyone. Thank you so much for coming out. I know it's a very busy day with events happening all over town, so you know, it is what it is. As soon as the weather turns, all the programs start coming out of the woodwork, so you have to pick and choose. But thank you so much for joining us for our first lunch and learn with a non-museum staff member. And thank you so much to Greg for volunteering to help us with this program. So, if you don't know me, I'm Thomas McLennigan. I'm the Education Outreach Manager over at the Museum of the Aleutians. And we do begin every program just by acknowledging that the Museum of the Aleutians and all of our programming is located on the ancestral and unceded traditional territory of the Unangax. And with that said, thank you for coming to How to Protect Your Health with Greg Walter, who's over at the Aleutian Family Health Services. That's the full name. So with that said, I'll turn it over to Greg and we'll get going.
Thanks, Thomas. Hi, everybody. Thank you all for being here on this beautiful day. So yeah, we're going to talk about how to protect your health today. And just introduce myself briefly. I know everybody in the room, but I'm Greg, a practitioner. It's my baby Ned. Us out here on a walk in Alaska. Just a little brief history of what I've done and how it got me to here. I was a social worker for 6 years after I got out of college. It's the best picture of social work I could find. Worked with folks who had HIV and were homeless, and helped them provide stability in their community. Then decided I wanted to become a healthcare provider, so I went back to school, became a nurse, and then a nurse practitioner in the program at Yale, and really loved it. While I was a nurse, I worked in an oncology unit, helping folks who had cancer. And then in the NP program, I did a specialty in diabetes, and got really passionate and excited about working on managing that condition. It can be complicated condition for healthcare providers to treat and for patients to have. But what I love about it is that it's one of the few chronic health conditions that responds really well to lifestyle changes. And I see people make huge changes in their diabetes management through changing what they eat and their activity, and then being able to come off of or significantly reduce their medication. So it's a fun condition to get to treat because people get to actually improve their health after they are diagnosed. That's just a picture of my wife and I and our baby out on the beach for sea stars. Okay, we're going to play bingo today. We printed out some cards, which I'll hand out now. And oh, thanks, guys. Otherwise occupied. There's a little twist to the bingo, so each square on a question. So the questions are all things that we'll talk about here. So when you see one that you know the answer to, write it down. And then when you get 4 in a row, hold your hand up or say bingo. And the first 4 people to get bingo get $10 gift card from Museum of the Aleutians. Sweet. All right. So get into it. So the sort of big picture summary that we're going to talk about today is what does the evidence say about lifestyle and health? We all hear lots of claims about you should do this or you shouldn't do this diet, stop eating this food in order to improve your health. And they'll all say studies say or the data shows this. What does that really mean? So you might all know this, but there's lots of different kinds of studies, and some of them are really reliable. And if one researcher does the study, then another one does it, they'll find the same results almost always if it's a really reliable study. But other kinds of studies are really not reliable and are more just like an observation. I saw this in a few of my patients and I noticed it. The highest form of evidence, the best kind of research, is called a randomized controlled trial. Anybody familiar with randomized controlled trials or know what they are? So it's a study where there's a placebo group and an intervention group. And the group that's getting a placebo is not getting any treatment at all, but they don't know that, and the researchers also don't know who's getting a treatment and who's not. And the intervention group is getting whatever treatment they're looking at, whether it be a lifestyle change or medication or a new surgical treatment even. And then when you compare those two, you know that the actual difference between it is just the intervention, as opposed to whether somebody had faith in the intervention or the researcher was really confident. You're just evaluating whether it works or not. So randomized controlled trials are what we're going to look at today for the evidence for what protects our health. So I've got a couple of goals for today. The first one is to facilitate thoughtful decision making. So like I said, we're all sort of inundated all the time with advice about eat this or do that in order to have better health. And when I went through school, I learned how to read these studies and how to sort of evaluate evidence to learn whether something is worthwhile or not. So I want to kind of try to communicate some of that. And then the other is to use a harm reduction approach to healthy lifestyle change. Is that something anybody's familiar with, harm reduction? Yeah. Anybody tell us a little bit about what they know about harm reduction?
It's like you can improve your health incrementally and maybe more steadily and for longer if you don't approach it as a total, like an immediate change of 100%.
Yes.
Like maybe weaning yourself off of a substance, or instead of saying, I'm not going to eat any sugar this week, you say, well, I'm only going to have one cookie after dinner instead of 17, which is how many I could have. But it's like reducing the harm, but not. Because I think a lot of people, myself included, if you do that 100% abstinence thing, the minute you make a mistake, you throw the rest of the day or the week or the month out the window.
What's the point?
Yeah.
Cool. Thank you so much. Much better said than I was going to say it. So that's going to kind of be the theme of what we're talking about today. No abstinence, just how can we take steps in a direction that will improve our health. So we'll start off by talking about diet, because that's the biggest modifiable risk factor for health that we all have. Like I said, there's lots of different kinds of data about health, and some things we have very reliable data, and some things we have sort of like indicators that things are healthy or not. One of the things that we have just rock solid evidence on is certain foods that we know we should avoid that are harmful to our health. And one of those is ultra-processed foods. There have been definitive studies showing not just an association, but a causative link between ultra-processed foods like, McDonald's French fries, tortilla chips, sodas, things that don't really bear any resemblance to the way that the food comes out of the ground. Their impact on our health is really well determined. They've been definitively shown to cause irritable bowel syndrome, diabetes, high blood pressure, dementia, and even mood disorders like depression and anxiety. Another one that we have really good evidence on is salty foods. Anybody know why salty foods might be something that we want to avoid, or what the health impacts are? Yeah, Susie, heart. Yeah, for sure. Yep. So salty foods they hurt the arteries, they hurt the heart, they make it all work harder. They increase the pressure in the blood vessels, and that makes the heart work harder. Leads to risk of heart attacks and stroke over time. And then the last one that we have really good data on for a food that is worth reducing the intake of is red meat. So one of the most common kinds of cancer is colon cancer. It's becoming more and more common over time. People are developing it younger and younger. The recommendations for starting screening colonoscopy keep getting younger and younger. It's now down to 45. So all red meats increase the risk of cancer, but some more than others. So all of them are in the family of carcinogens, things that are studied and known to be associated with causing cancer. But carcinogens have different levels. They're called groups. So group 1 carcinogens are terrible and shown definitively to cause cancer. And then the lower down groups may have an association, but not as strong. Examples of things in the group 1 carcinogens are things like arsenic, formaldehyde, and asbestos. And processed meats are in that category as well. Hot dogs, deli meats, and bacon are in that group 1 along with asbestos. So again, not saying it can never happen again, but being aware that the recent research shows how dangerous they can be. And I just want to talk a little bit about diets. So there's always some diet that's fuzzy, and people are saying, oh, this is the diet that'll improve your health and make you live longer and lose weight quickly and keep it off. There's lots of money in the diet industry, and they have been studied pretty intensively with rigorous randomized controlled trials, and there just aren't any that cause significant long-term healthy weight loss. Generally, the ones that work are associated with a weight loss of a few pounds, maybe 5 pounds or so. Any more than that, almost always the weight loss is followed by an increase of more than was lost in the first place. And changes like that in weight are actually more dangerous than just staying at the weight someone was at to begin with. Important to remember that weight loss is not a health outcome. So people might have a preference to be at a certain weight, and that's totally fine. There's nothing wrong with wanting to be at a certain weight, but it's not a health outcome. So when people say they want to be healthier, and they're in the clinic with me, I talk about things they can do to reduce their risk for diabetes or high blood pressure, improve their cholesterol control. But weight, as we'll talk about on the next slide, is more and more we're learning almost completely controlled by our genetics. We have much less control over how much we weigh than we used to think. As a society, we love to hate people who are overweight. We have tons and tons of bias against fatness, but it's really not evidence-based at all. So it is worthwhile to live a healthy lifestyle and do things that are healthy, eat whole foods, be physically active, but I never encourage people to do that in order to get to a certain weight, because the evidence shows that it's not associated with health outcomes. And again, the yo-yo is tending to worse health than not doing it at all. Data on exercise. So exercise, along with cutting back on processed foods and eating more whole foods, has been shown really reliably to improve health outcomes in like many categories. For one example, diabetes is much better controlled with exercise. Our body's ability to process sugar increases a lot when we are moving. High blood pressure improves. Mental health, as probably we all know, just like anecdotally, when you're not moving, your mental health gets worse, and when you're able to get out and walk or do what you enjoy, the data shows that depression and anxiety get a lot better. Decreased risk for Alzheimer's, other cognitive decline. Almost every type of cancer, the risk is reduced with exercise. The one thing it doesn't do is weight loss. A lot of people do exercise with the goal of weight loss. It doesn't reliably lead to weight loss. We're not really sure why. It might be because we tend to get hungry after we exercise, which is healthy, replace those calories that we burn. But again, if we're looking at important health outcomes, then that's not a reason not to exercise. It's a better reason to stay active and focus on health outcomes that really matter. So tobacco, this gets back to what Lynn said about harm reduction. I don't need to stand here and lecture you guys about that tobacco is bad. We all know that. That's long established. It's associated with just about every kind of cancer. But recent research has shown that a harm reduction approach, cutting back a little bit on tobacco use, can make a big difference with health outcomes. So going from a full pack of cigarettes a day to just 3/4 of a pack, 15 cigarettes a day, makes a statistically significant reduction in the risk for developing lung cancer. And that's not like cutting down over time, that's just sticking 15 cigarettes for decades. So when I'm talking with folks in the clinic and they want to work on health behaviors, that's my attitude, is whatever change you can make today that you can stick with, let's do that. The next thing I want to talk about is sleep. Something that I think we don't think or talk about enough, but another thing there's a ton of great data on. So important. We spend a huge amount of our lives asleep, hopefully, and it's really important to our bodies. A lot of damage that gets done to our bodies during the day is repaired overnight while we're asleep. Getting good quality sleep for 7 to 8 hours a night has been shown to decrease the risk for chronic diseases like diabetes and high blood pressure that I keep coming back to. It also improves mental health, because we all know when you don't sleep well, mental health gets worse. So less risk for anxiety, depression if you don't have those, and then mental health conditions are better managed if you already have them in your sleep as well. Another thing on sleep that's really underdiagnosed and not talked about enough is sleep apnea. It's a condition where people stop breathing for a few seconds, up to a minute, overnight while they're asleep. And it's really dangerous. It causes lots of damage to all the organs in the body. Basically, you're not getting oxygenated blood to your brain or your heart, your kidneys, and they all suffer for it. And it's really easily treatable with either a CPAP machine that blows air into your mouth and nose, or with a device that goes in your mouth that pulls your lower jaw forward a little bit. People who get treatment, I see this all the time in clinical practice, they come in and they say, oh my goodness, I have so much energy, I feel great, I'm awake throughout the day, I don't need to nap every afternoon anymore. No medication is needed to treat it, which is always nice. So if you snore, you know someone who snores, or you wake up in the morning consistently not feeling refreshed, talk to your provider about this. Sleep studies are really easy to do. You can do them here on the island. And if it turns out you have sleep apnea, treatment is really effective. Another thing I want to talk about with sleep is treatment options for insomnia. So insomnia, super common. Lots of people have poor quality sleep. And people often come into the clinic asking about what medication can I use? Should I use melatonin over the counter? Should I use Z-Quil? Is there a prescription that's better? And over the past 5 years, there's been a ton of studies into what treatment is the most effective for insomnia. And by far, it's a therapy, cognitive behavioral therapy for insomnia, or CBTI. And it needs to be delivered by a specialized therapist with training in this kind of CBT. But basically what they do is help you to consolidate your sleep so that you're sleeping really well for a shorter amount of time and then gradually increase it out. And it's been shown to really lead to high quality sleep at night. The reason why it's better than medications is because all sleep meds, no matter what they are, harm the way the brain works during sleep, and so you don't have that deep restorative sleep when you take sleep medicine. They might help you to fall asleep and stay asleep all night, but you're not getting the rest and recovery that you would get if you were able to sleep well without meds. So again, not saying don't take the meds, but if you can get access to CBTI or improve your sleep without meds, that's often higher quality sleep. And then I want to talk a little bit about sleep hygiene. Anybody familiar with sleep hygiene? Or yeah, anybody, what's involved in sleep hygiene? What are some tips you can give?
Because came up a family member was really, don't have your phone near you,
Yeah.
or cut screens an hour before. Look at, just everything around it, right? The clothes you wear, to taking a shower before, and just kind of really, it's just more just like intentional thinking about your sleep versus just go to bed and just focus. But I'm sure there's a lot more than that. But
No, totally. And that stuff, the screens especially, there's some pretty good data behind that. Staying away from screens for an hour or two before bed, and definitely no screens in the bedroom, no television or cell phone. Another thing that's been shown to really improve sleep quality is keeping the bed just for sleep and only staying in bed when you're asleep. So when you wake up in the morning, getting up as soon as you wake up, even if you're still feeling groggy. And if you wake up in the middle of the night and you don't fall back asleep right away, getting up out of bed, reading a book, doing something really calm, and then when you get sleepy, getting back into bed. Doing that over just a few nights, I did this and it really worked. You fall asleep so fast, like it really made a difference for me. Sleep association. So avoiding doing anything else in bed. And then the other important part of sleep hygiene is staying active and engaged all day. So physical activity during the day, obviously not close to bedtime, but no naps, doing things that are interesting to you all day long so that you can build up that what we call sleep pressure, and then when it comes to bedtime, feel really tired. Okay, so I keep mentioning these two common chronic conditions, diabetes and high blood pressure. Everything before now has kind of been about generalized health recommendations for everybody, but I want to get specific and talk about my most passionate condition, diabetes, and then after this we'll talk about high blood pressure. So things you can do if you don't have them to reduce your risk, and things you can do if you do have them to improve control of blood sugar. Anybody know what diabetes is? So basically high blood sugar. And type 2 diabetes, the most common kind, occurs when there's too much sugar in the blood over the course of years. And when the sugar is high, the body loses its ability to use that sugar, to pull it out of the blood and turn it into energy. And so the sugar just sits in the bloodstream. And when sugar sits in the bloodstream over a long period of time, it causes harm all throughout the body. Injuries to the brain, the eyes, the kidneys, feet, all the things that go wrong with diabetes are because sugar is sitting in the blood for too long. But like I said earlier, the exciting thing about diabetes is that it is largely reversible with healthy lifestyle changes. Hi, girl. Improves the ability of the body to use its own sugar. Exercise strengthens the heart, and so again, it kind of counteracts the negative effects of our diet, and allows the heart to work harder, which all the salt that we eat forces our heart to work harder. So strengthening it through exercise can push off the effects of high blood pressure. Providers in the medical field often expect patients who are in their 60s and 70s and older we sort of believe that blood pressure just naturally goes up with age. That everybody in their 60s is probably going to be on one blood pressure medicine, 70s 2 or 3, and just going to have to increase them over time. That's what I learned in training, and that's what we often see in clinical practice. But when we looked at people who live in completely non-industrialized societies, who just eat basically whole foods, who are physically active throughout the day, the tendency is actually for blood pressure to go down over time. That's sort of what's normal as we get older. People stay active and continue eating whole foods. So just another pitch that these conditions are largely optional. They're caused by our society. We don't choose them ourselves. Like, this is the world that we live in. And it's very hard to swim upstream and make these changes. But I have seen people do it, and they feel so much better. It's so exciting and fun for me to see them get off the medications and feel so much better.
You talk about processed foods.
Yeah.
Can you make them yourself? I mean, if you make French fries on your stove top and whatever, would that still be a processed food?
Yeah. So there's getting back to the harm reduction thing. So there's almost nothing you could make at home that's going to be as bad as a McDonald's French fry. So it's still processed, right? Of course, if you bake a potato, then that's going to be healthier than frying it in oil and adding salt. But if that's the way you want to eat a potato, that is absolutely going to be healthier than getting getting a bag of chips from the store. The other thing, I don't know if you guys know the author Michael Pollan, but he wrote a book called Food Rules a bunch of years ago, and it's really great. It's just a bunch of really simple instructions. One of them is shop around the perimeter of the grocery store. So the stuff that's being chilled, basically, fruits and veggies and dairy and meat, and avoid the aisles in the middle because everything there is shelf-stable and probably full of salt and carbs. Another one of his tips in that book is eat whatever you want as long as you make it yourself. So potato chips, fried chicken, they take time to make. Like, they're kind of complicated and expensive and time-consuming. So he says, make as many French fries at home as you want, because the reality is you're not going to do it every day. So I guess that's my answer.
But a lot of people can't afford to shop on the outskirts of the store. You know,
Absolutely.
I know this is a totally different subject, but it's like the system is designed to keep poorer people more unhealthy, and they also have less access to care. I mean, it's like this vicious cycle, and then we judge them for being unhealthy.
That's right.
You know.
Yep.
So
Yep. Why don't they take care of themselves?
it's pretty messed up.
Yeah, 100%. This is all easy advice for people who have income and means and ability to research to follow. But yeah. I would love to come back and do a lunch and learn on what a miserable disaster our society is. How we have to tear it all down.
Can I kind of do that?
Please, I would like to listen to yours. Yeah. But I'm totally with you. Yeah. Okay, screenings. I wouldn't be a good healthcare provider if I wasn't nagging everyone about getting your colonoscopy, so I had to get this in here. Like I said at the beginning, colon cancer is the most common form of cancer. Healthcare providers love the exciting stuff, working in emergency rooms and doing surgeries and treating patients with severe diseases. But by far, the most lives that we save are when we just place a referral for a screening colonoscopy or a screening mammogram. These cancers are so common and so easily treated when they're caught early. So I think everyone in this room knows this, but we should all be getting colonoscopies at least every 10 years starting at age 45, and mammograms every 1 to 2 years starting at age 40. And the mammogram bus is going to be back this summer in July, so if you need one, come by the clinic, get you a referral for free. And colonoscopies, almost all insurances will pay the whole cost of that, because the insurance company knows that it's a lot cheaper to do a screening colonoscopy than it is to pay for someone's treatment for colon cancer. And that is it. Any other questions anybody wants to ask? Yes, ma'am.
When did you say the age was for mammogram?
40.
40.
That's dropped as well over the past few years, yeah.
Okay.
Every 1 to 2 years for mammograms?
That's right. Different societies have different recommendations. I usually encourage folks to go every year, but I think the official recommendation from the Department of Health is every 2. All right, we got any bingo winners? All right.
Alright!
Woohoo!
Wait, bingo's just like one lane, right?
4 in a row.
Okay, good. I didn't want to black out.
All right.
I hope so. If I got the questions right,
I'm gonna trust
We
you.
trust you.
Right there.
Good. All
Go.
Dang.
But maybe they're not ready.
We're
We
gonna
trust
trust you
you.
guys, yeah.
Can we make sure we're doing
Oh.
With the diabetes, I know we talked about exercise.
Yes.
Decreasing it, but whole foods as well.
Yes.
Okay.
Yes.
Okay. And then most diets lead to permanent weight loss falls.
Yep.
Gotcha. Cool.
Awesome. Thanks.
Now I feel like I deserve it.
Yeah.
So in terms of harm reduction, you talked about sleep, so
Yeah.
it's always a challenge for me. I'm eating for a lot of things. But if we do melatonin, like I'll do that. I know
Yes.
that there's wide variation in terms of how, let me say it's 10 milligrams, but it could be like 300 if it's not.
It's not regulated, yeah.
But it seems to work, right, in terms of the harm reduction, and that, I used to work in HIV for like 11 years, and all that harm reduction model, like
Yes.
provisional tries, everything. But what are your thoughts on melatonin in terms of, versus being perfect?
Yes. Yes. Thank you. Great question. Awesome question. So if you want, so this goes for all supplements. There's a group called USP, United States Pharmacopoeia, and they are an independent group that has some government funding, and they test supplements to see whether they contain exactly what they say they contain. Some supplements, maybe like half the ones you see at the store, will have a little label on them that says USP certified, and that means that they are going to the store, taking a bottle and testing it to see does it have the number of milligrams of whatever that it says it has. So if you want to do any supplement, I always recommend getting one that's USP certified. In terms of whether to use melatonin, it's a natural hormone that's in our body that makes us sleepy. It's definitely effective. Tons and tons of people take it. It can be hard to get off of it when you want to stop using it, and it has been studied and shown to decrease sleep quality. So sleep on melatonin is not as exogenous melatonin is not as restful as sleep without it. But again, like you're saying, harm reduction. If the alternative is 4 hours of crummy sleep, and with melatonin you're getting 8 hours of pretty decent sleep, then that's a slam dunk to me. If there's a way to improve sleep quality and do all the magic things and see a CBTI therapist, that's great. But yeah, I don't tell people never take melatonin. Yeah, it can be really effective.
What about supplements in general? Like I think everybody knows I had bariatric surgery a couple years ago, And so I take a multivitamin that's specific for people who've had bariatric surgery. And then I also take probiotics because someone told me that was good for me and I listened to them. But then you could spend hundreds of dollars a month buying other supplements. Like what is important to take, especially as we're getting older?
Yeah. Oh, what a great question. Thank you. So there's like one piece of advice for the general population and then one for folks who've had bariatric surgery.
Sure.
Right? So in general, there's been, again, like with the diets, there's lots of money to be made on selling diets, and so there's been lots of study into them, and they don't publicize these studies because they don't show that they work. Same thing for supplements. They've been studied a lot, and there's almost no evidence that they make a benefit in the general population. What they're trying to do is give you the benefits of a whole food diet with the simplicity of a pill. So you get all those supplements that we know studies show, like the lycopene and all these different things in the fruits and vegetables that we eat. Those are what causes our health to get better when we eat broccoli and carrots and stuff. But if you get them from a pill, it just, for some reason, doesn't work the same way. So I generally, because they're really expensive, patients ask me this all the time, and I generally recommend, if there's not a specific health condition that requires you to take supplements, I generally recommend against it. And say whatever money you were going to spend on those supplements, use that toward buying more whole foods. Which, like we were saying, that's a whole other issue. Like you cannot, and yeah.
So multivitamins? What do you think of those?
There's not a lot of benefit to them. They have the vitamins that are in whole foods, but it's so much better to get those vitamins from whole foods themselves. They're not harmful, but they've been studied a lot and without showing any significant benefit.
I mean, I've seen these studies, and these are worthless except for this one thing. Then the next studies, this is worthless except this other thing. And then the third one says, except for the third other thing.
Yeah.
So they always say there's one little thing.
That's right.
It jumps around and studies.
Yes.
So I keep taking them.
Yeah, and there's no harm to it. If you want to take it and it makes you feel better, there's no harm to it. The thing we see consistently over and over in the data that is just, at this point, beyond question, is the best thing to put your money and effort toward is eating more whole foods and avoiding processed foods. Yeah, that's the slam dunk for good health.
That's the idea is, if in a given day you eat a couple different foods, and so you're missing out on a lot of things anyways, and if you take everything supposedly packaged into a pill, you are making up the difference. And what you're saying, studies don't really support.
It doesn't actually replace the things that it says it's replacing. They're in there, but your body doesn't absorb them the same way. It just doesn't have benefit.
What about vitamin D?
Because that's an exception.
Okay, because we've been doing that, and my son got tested for something else, and they checked his vitamin D levels, and like, wow, he's up, really well. And I really think it's had more to do with vitamin D supplements.
No, totally. That's one that I don't even test vitamin D because we're all deficient.
Right.
Like, you cannot get enough up here.
Here, you mean, or everywhere?
In Alaska. Yeah. I mean, probably in the northern lower 48 too, but up here, everybody needs to be taking a supplement between 2,000 and 5,000 units every day, year round.
How about vitamin C?
It's not hard to get from fruits, and so I just recommend having citrus fruits.
Well, that's the thing. They might not be eating their foods for whatever reason.
Sure, and so that's where the harm reduction approach comes in, right? If you, for any reason, cannot eat those whole foods that these things come from, and you want to get that vitamin, then there's no harm in taking the vitamin. But my recommendation, if you can, is always to get it from the whole food. But certainly, getting back to your question, Lynn, different people's bodies absorb things in different ways, and so that's something to talk with your provider about. B12 is important, probably iron. So, but that's separate.
What about the probiotic?
So that's been studied a lot compared to yogurt. So probiotics absolutely help. Our diets kill a lot of the good bacteria in our guts. And a lot of
gin?
Sorry?
The gin?
And a lot of medicines that we prescribe also kill it. Like there's lots of things that we do that wreak havoc on our guts. And I'm sure you've all heard, like the gut microbiome is so much more influential than we ever had in any. I think we're just beginning to understand that it controls so much about what's going on with us. So replenishing those good bacteria in your gut is like crucial. Whether you get that from a pill or from yogurt, there's not a lot of difference. So if you like yogurt or other fermented foods, having those every day is just as good. Make sure there's lactobacillus in there, which there almost always is, and that's just as good as taking a probiotic.
I eat yogurt, but not every day.
So I'd say one reasonable thing would be to take a probiotic tablet on the days that you don't eat yogurt. It's good to get some of that good bacteria every day, one way or the other. But yogurt is just as good, which is the relatively new thing that I learned a couple years ago. They did a study that looked at, because we often give people diarrhea when they take an antibiotic, which we prescribe all the time, because it kills all the good bacteria in your gut. And they looked at, is it better to prescribe a probiotic with the antibiotic or to give people yogurt, and the result was exactly the same. Any other questions? These are really great questions.
Yeah. So if you were not a medical professional and you were looking for good medical information in the middle of the night, which I know none of us should do, then we'll diagnose ourselves with everything, but like, what are your sources? Is it like the Mayo Clinic or?
Yeah, totally. I also don't shame people for researching their health. Like, I don't get why doctors do that. I've never met a doctor who was like okay with letting patients Google things. It would be so weird if you weren't curious and didn't want to look up what was going on with you. But I think everybody who's gone into the medical clinic has been told that they're a bad person because they research their own health.
Yeah, maybe it's because a lot of them come linked to advertisements. Like,
Sure.
Go to like National Institute of Health.
Totally. So the resource that I use is called UpToDate. The clinic pays for a subscription for it, and it's really fantastic. And a lot of their patient education information is available for free online. So if you type in the thing you're curious about with UpToDate, you can probably find some good patient information about it. But absolutely, Mayo Clinic and Cleveland Clinic both have lots of patient-facing information online. The other thing is, I love talking with folks about this stuff. So call, email, chart me. And I would love to send you information about whatever you has questions about. But yeah, Mayo, yes, sir.
And when I first worked in the clinic back in the 90s and did HIV stuff exclusively, I remember that we had an internist that would, it was her experience that HIV was the first time where patients were really, some of it was out there research, right? We had to counter some bad stuff. But they come in and really engage in her in a debate about stuff. And she loved it, right?
Yeah.
It was like, we've always just, the old school, like the doctor gives you an order,
Yep.
follow the order and go home.
Yes.
And she really appreciated the fact, even if it came in a little goofy sometimes, it got them into a conversation about what science might be related and how it might have been twisted, and it really just kept the engagement level, which is good for people with their health because they're really focused.
The carcinoma controlled, and that's something that gets advertised a lot. And there are all kinds of names, miracle cures. Is there any value at all?
No, that's been studied quite extensively as well. Anecdotally, I have a bunch of patients who swear by it. My parents took it for their osteoarthritis and it helped them, and they gave it to their dog, and then they found that their dog was like jumping all over the place and having fun and didn't have pain anymore. But when it's studied in randomized controlled trials, it is not better than placebo. So again, like most of these things we're talking about, it's not harmful. It does help some people, but it's not a slam dunk that the evidence is really weak. So I don't discourage people from trying it, but if you don't see a benefit within a couple of weeks, save your money.
Yes,
Yes, it is. Yeah.
I have two more things.
Yeah. This is awesome.
This is a billable visit. This is now level 4.
This is so much fun.
I just want to say I really appreciate you talking about how weight is not always a result of just complete sloth and one's health, but because as a woman who is a little heavy and was formerly a lot heavy. I can tell you that I avoided going to the doctor a lot of times, not necessarily providers here, but other places, because you'll just get diagnosed with being fat, no matter what your problem is.
Yep.
You got a headache, lose some weight. Your period's irregular, lose some weight.
Yep.
You know, you can't sleep, lose everything. It's
Mhm.
like they stop listening. So
Yes.
I really appreciate that you're aware of that and that you're not doing that with people.
Thanks for saying that.
Because women will not go to the doctor
Absolutely.
because they don't want to be fat shamed. And maybe men too. I don't know, I don't see.
We do it a lot more to women. We do it a lot more to women. Our whole
Yes.
society is obsessed with women's bodies. And yeah, without a doubt.
Okay, so this is, I don't mean to embarrass anybody, but I have read that there is no scientific evidence that women in close proximities, periods, sync up. However, my lived experience as a woman who has worked around other women, mostly only other women, for the last 30 years, I mean, until I stopped having my period, tells me that our periods did sync up. So what is the deal there? Why
I
is
agree
the
with that
research-
research as well.
Why is the research not aligning with what women are saying?
I don't know.
I
I
love
would
that
say,
question.
yeah. The medical system hates women. Like,
Really?
Yeah.
You're kidding. Everyone else loves women. I can't.
so there's no funding for things that only affect women, you know?
Yeah.
I'm gonna look into this. I don't know. All I know is that it's been like debunked, but I didn't read, you know what I mean? Like, I don't know. So I'll look into it and I'll let you know.
Okay.
Yeah.
I just think it's interesting. I mean, it seems like there would be like an evolutionary
Totally.
reason for it. Like, wouldn't it make sense if all the women in the tribe were kind of on the same cycle, because then they could help nurse each other's babies and all that kinds of stuff?
Yes.
I mean, so why wouldn't they sync up?
And if you see it does happen, like it is real,
Mhm.
then why are they saying, yeah, I don't know.
Yeah, there's no reason for that to happen. I mean, yeah, just, yeah, if you can figure it out, we want to know. Women everywhere want to know.
Whatever's out there, I'll find out and let you know what's out there. Yeah.
I have a question, and it kind of goes back to Jim's question about the supplement. He was speaking about, collagen, daily collagen, because I take it now, to be fair, there's a bit of vanity in there, hoping that it will keep me young, patiently, and good skin, but also for like joint issues, like, because it's genetic throughout my family, arthritis and those. Is collagen a good supplement, or is that on this?
That's a really good question. I have not looked into collagen.
Okay,
That's not what I get asked about, so I'll look into it and let you know.
okay.
Well, I need to know that too, because I've even got Matt taking it.
Yeah.
We'll need an email list from this group. So yeah, I've heard people say a couple of times that they took it, but I haven't looked into it, so I'll find out.
I have a brother that smoked for a long time.
Yeah.
And I remember once reading or hearing that if you quit, that you could start to recover. And I'm wondering, if you could tell me anything about that,
Yes.
just as an encouragement to say,
Yes.
Steve, you quit smoking. Within this amount of time, is
Yes,
there some truth there?
absolutely there is. So the biggest thing we look at with smoking is lung cancer. It increases the risks for all kinds of cancer. We see lots of bladder cancer, head and neck, and every bad health condition is associated, and all those risks do improve with time. But the thing we have the most data on is lung cancer. And I don't have the numbers off the top of my head, but I know that it drops off when you quit smoking, and then at 15 years, an ex-smoker has the lung cancer risk of a never smoker. So it takes time, but your body does heal the damage that the nicotine and tar do. So when people have smoked within the last 10 years for at least 20 pack years, so like a pack a day for a year, we ask them to get like a low-dose screening CT scan of the chest every year. And we stop getting those CT scans 15 years after people quit smoking, because it's very clear that they're not at elevated risk for lung cancer. So it drops off gradually over 15 years, but without a doubt, the body does heal itself from that, yeah.
So we can make up for our stupid use.
Heck yeah, yeah. Yeah, and even 1 year later, your risk is reduced, right? It's not zero, but as soon as you quit, your body starts healing the damage.
Thank you.
Yeah. Anything else? This has been so much fun talking about these questions with you guys.
So thank you everyone for joining us. Our next talk will be on June 22nd. If that's not a Saturday, then it's whatever. Saturday is closest to that. But there will be flyers and we'll be on the community calendar and all of that. If you're looking to re-watch the talk after, I did have a software crash on me. So it's currently in 2 different videos, so I'm gonna pull them down, combine them, and then I'll repost it. We lost probably 3 or 4 minutes of the talk. But the majority of the talk will be on YouTube, hopefully by Tuesday or Wednesday. But yeah, thank you so much for joining us. Thank you again.